These cysts are natural, they're a natural part of your menstrual cycle, and they disappear and get reabsorbed by themselves. You don't need to remove those, obviously. However, endometriomas and PCOS related cysts do lead to infertility. These type of cysts affect fertility because they interfere with ovulation. In the case of PCOS, there is a hormonal imbalance that leads to anovulation cycles. So that's menstrual cycles where the woman does not ovulate. And so, of course, that's going to affect your fertility. If you're not releasing an egg to be able to meet with the sperm, you're not going to be able to fall pregnant. With endometrioma, as previously mentioned, it affects fertility because it damages the ovarian tissue itself. And so that's going to have a negative impact on your ovarian reserve. So the millions and millions of follicles that are found in the ovary, some of which would have gone on to rupture and release a mature egg, these are all going to be damaged by the endometrial tissue that is found in the ovary where it's not supposed to be. And so endometriomas will significantly affect your ovarian reserve and prevent even ovulation from happening. So let's talk a little bit more about endometrioma and how this type of cyst can be treated so that you can go on to conceive. So the first way would be to try to manage it with a non-surgical approach. So we have the progesterone only type contraceptions, and whether it comes in the form of oral contraceptive pills or the injection or the intrauterine devices. The purpose of having the release of progesterone is that it reduces the flow of the period whilst shrinking the size of the endometrial tissues, ultimately reducing the endometrioma. The second way is to use the gonadotropin releasing hormone agonists. These will temporarily induce menopause by reducing the amount of estrogen, and this helps to effectively reduce the endometrioma. But the problem with it is that it can trigger hot flushes, it can cause bone loss. So literally all that you would have experienced if you were actually going through the menopause is what you will endure with gonadotropin releasing hormone agonists. But thankfully, the time for which you will need to be on this medication is short term. Then there are aromatase inhibitors like letrozole, and this significantly reduces your estrogen level and will also reduce the size of the endometrioma. This method is used in very severe cases, often when all of the other treatments that I mentioned previously have failed. Now, if these pharmacological options have failed, the only option that we are left with to deal with the endometrium is the surgical option. Now, remember, this option is used when, number one, pharmacological methods have failed, as I mentioned, but also number two, if the endometrioma is quite large. That being said, this surgical method that I'm about to mention now is the only way to deal with the other type of complex cyst, which are the dermoid cyst or the cysta adenomas.